Crowfoot Village Family Practice is a community-based practice in Northwest Calgary that has 16 family physicians and 25,000 patients. What makes us unique is that we have a different funding model, which we call patient-based funding, and we use a formal attachment process. So what that means is we enroll patients to our practice by using a form that they complete on their first visit with us, and it really formalizes the patient-physician relationship, but it is by complete patient choice. And then the funding model really plays in because we receive a lump sum of money for a patient's care for the year. That funding is based on age and gender only, but it allows us to provide care in teams. So where in a fee-for-service model, the physician is really bound by some rules around having to see the patient themselves, we are not bound by those rules. So it enables us to use a full care team of pharmacists, dietitians, nurse educators to provide care for the patient. So really our approach to care is right provider, right time for the patient. A great example of what we do would be using a diabetic patient. A patient might come in for a periodic health exam or an annual physical, and their blood work might reveal that they have high blood sugars, for an example. Rather than the physician having to manage that, because it can actually require quite a bit of intense care to do, we would refer a patient to one of our certified diabetic educators. Typically in our clinic, those are pharmacists, and the patient will work directly with the pharmacist to get their blood sugar under control, to learn about fitness and exercise that might help better manage their condition. They may also meet with other providers within our team, whether it be a registered nurse for further education, or if they've got other co-issues like hypertension, which is often the case, or depression, anxiety. We also have a psychologist, dietitian, those types of people, and our team can refer with one another. So all of that can happen under the direction of the physician, but completely independently of them as well. We initiate patient care with something called a meet and greet visit, which is very common in primary care, where we bring the patient in for simply almost an interview, and it really is a two-way collaborative interview where the patients learn about our model of care and our clinic and the services we provide, and we give them the enrollment form at that time, which they have the option of signing off on. We allow them time to review it. As far as I know, it's never been an issue. Most patients are quite agreeable. The form is actually comprehensive in terms of explaining the services that we provide, but also in ensuring that the patient understands they have flexibility and choice in their care.